Everyone, we will be getting started in 1 minute. Okay, everyone, welcome. On behalf of the Office of the Chancellor of the University of Pittsburgh, the Office of the Provost, and the School of Social Work, and Dean Betsy Farmer, we'd like to welcome you to the Center on Race and Social Problems and our CRSPCast series. Welcome back to our return visitors. My name is Jay Hughley. I am the Interim Director here at the Center on Race and Social Problems. And I'm thrilled today to be joined by my illustrious co-host, Dr. John Wallace, who now, if you haven't heard, we need to call Vice Provost John Wallace because he has been named the new Vice Provost for Faculty Development and Diversity here at the mighty University of Pittsburgh. So, Vice Provost Wallace, welcome, hello, and congratulations to you.
Thanks, Jay.
So we're very excited today to have a great guest speak on the topic of Black men's mental health, especially in this time of multiple adversities in the Black community, with COVID-19 disparities, with police violence against Black men, Black women, the Black community, and trying to grapple with all of that, do our jobs, take care of families, take care of our communities, and stay in one piece. And I'm excited to hear from guests today to understand how we can navigate these issues. To just say a little bit about our center, the Center on Race and Social Problems has a mission to conduct and disseminate applied social science research on race, color, ethnicity, and their influence on the quality of life for all Americans. You can follow us on social media at PitCrisp, and our website, among other things, has our full library of 100, literally 100 different talks on race and different topics. So you should check that out. A little bit about how we flow today. First off, I know many of you want continuing education units for this talk. You can get up to an hour for this talk. So you will receive an email with a link to set that up after the talk if you register. Today's lecture will be recorded and posted on our website and on YouTube. It only takes a day or two. So if any of your colleagues or friends have missed it, you can refer them to that shortly. And importantly, as you have questions today, submit them in the chat function of the webinar. And you can do that at any time. You do not have to wait till the end. You can just get in there and ask your question. And we are consolidating similar questions and asking them of our guests in the end. So with no further ado, I will pass it back to Vice Provost Wallace to introduce our speaker.
Thanks again, Jay. We're excited today to have a friend and colleague, Dr. Daphne C. Watkins. Daphne is a professor at the School of Social Work at the University of Michigan and the director of the Vivian A. and James L. Curtis Center for Health Equity Research and Training. Dr. Watkins' research cultivates a deeper understanding of the influence of gender role socialization on health over the life course for marginalized men. Particularly, her research focuses on generating new knowledge about the social determinants of health that explain within-group differences for Black men, evidence-based strategies to improve the mental health of Black men, and the intersection of age, culture, and gender. Dr. Watkins has received federal and private foundation funding for research, has produced several peer-reviewed publications, book chapters, and volume sections on men's health and how social determinants and gender dynamics place men at high risk for poor health. She's actually the past president of the American Men's Studies Association, the first woman and person of color to ever serve as president in the organization over its 30-year history. She also serves on several committees and boards aimed at improving men's health domestically and globally. In her scholarship, Dr. Watkins is the founding director of the Gender and Health Research Lab and the Young Men, Masculinity and Mental Health, the YBMen project. She teaches advanced graduate courses in research methods, program evaluation, theory, and community-based interventions. And she's also the founding director of the certificate program in mixed methods research at the University of Michigan. In short, she's a bad sister. We're excited to hear from her today. And just come on, bring the noise, Daphne. Bring the noise, girl.
Thanks, John and Jay. It's funny, when you said bring the noise, I could hear my 2-year-old bringing the noise behind me. So hopefully folks are gonna feel what it's like to work from home today, because we'll see how this goes with the kids in tow. So let me go ahead and share my screen. All right, can I just get a check? Hopefully folks can see this. Can you all see the slide? Great, okay, thanks Jay, I'm getting thumbs up. Okay, so let me jump right into it. I'm really excited to present some hot off the presses findings today with regard to some work that I've been doing for many years now. And just so folks know, I was really intentional about titling this talk, #BlackMen, Resourceful and Resilient in the Face of Adversity. I think that you'll get a sense for why I've decided to call this talk by this title as we get into things. So let me jump right into it. So I think I would be remiss to not start with the current state of the world and how the world is currently viewing Black men. And for those of us who've been doing this work for as long as I've been doing this work, we know that this state of Black men is not new. We know that the policing of Black men, we know that racism, white supremacy, just the different things that have been occurring with Black and brown communities is not new. But what we're realizing more and more is that we're seeing it more, right? People are pulling out their cell phones, they're capturing these events live. And so that plays a big part in some of the headlines that we're seeing with regard to Black men, with regard to things like what happened with George Floyd and certainly Rayshard Brooks and others, right? There are countless others that I could name here. So I just want to recognize this at the very beginning of today's talk. You know, the other thing that we have to consider in context is, you know, what's happening around COVID. And so I've been intrigued lately by a lot of the headlines that I've seen that have really had a chance to speak to the intersections of race and gender and COVID, not necessarily the deaths and the disease per se, because we've seen those headlines, but also headlines like the one I have on the screen here, which really speaks to what is the experience like for Black men who in this day and age should be wearing masks as they enter into public spaces. But what does that mean for Black men who could potentially be perceived as a threat, right? So there's this additional layer of complexity, even when it comes to things like public health informed decisions with regard to how we should conduct ourselves, like wearing masks. So for many Black men, it's a choice for them. And so while in many ways COVID is a pandemic, I think the experiences that Black men are having right now is an additional pandemic. So it's almost like a pandemic within a pandemic for lots of men of color and particularly Black men. So I'm going to start out here with some sobering statistics, but trust and believe I will not end here. But these are some of the things that we've seen prevailing in the literature for many years with regard to Black men's health. We know that the life expectancy for Black men or African-American men tends to be less compared to men and women of other racial and ethnic groups. We know that Black men have higher death rates than women for pretty much all the leading causes of death like cancer and heart disease. We know Black men ages or between the ages of 18 and 44 are less likely to report any kind of feelings with regard to mental health and mental health challenges and struggles. And as you can imagine, there's that idea of admitting to that additional level of vulnerability, right? Which certainly could potentially be one more strike against them. We know that Black men are less likely to seek help for these mental health challenges. So thinking about the stigma attached to mental health. Also, Black men are 5 times more likely to die from HIV and AIDS, and also that suicide is the 3rd leading cause of death for Black men, at least between the ages of 15 and 24. So again, hitting you with some really sobering statistics right now, but this is what we've been reading about in the literature to date. So now I have a question for the audience, all of my new friends here. You know, how do you see Black men? How do we see Black men? And by this question, I don't mean whether the Black man that you see is short or tall. I don't mean if he has a beard or a mustache. I mean, what do you really see? Do you see a son? Do you see a brother, a father, a friend? Or perhaps maybe you see a student, a colleague, a supervisor, maybe even a business owner. Essentially what I'm asking is, do you see a person? Do you see a past experience of yours? Maybe a stereotype, or even a person that you think you may know based on something you've seen on television or on social media, or even in the news? Do you see a human? Do you see yourself? So I pose these questions because it's really important to think about what you see when you see Black men, but also to hold yourself accountable for those thoughts that you have about the Black men that you see. As someone who has studied Black men for nearly 2 decades, I think a lot about how we train scholars on how to see historically underrepresented populations. Historically, the training has focused primarily on things like their risk, barriers, challenges, even their disease and death. The understanding here is that if you focus on the problem, then you can solve the problem and improve the health of Black men. But there is another way to think about this approach. It's actually called a strengths-based perspective. And a lot of the more recent literature is really taking hold of this more positive way to do this kind of work. Because you see, friends, with a strengths-based perspective, you don't assume or even limit your understanding of Black men to just their problems, right? We've done that before, and historically, that's how the work has been documented. Instead of focusing on the problems, you actually focus on the positives. You focus on the powerful and predominant trajectory of Black men, which essentially involves the things that many humans, all humans, really want out of life. Things like their ability to live, to learn, to love, to work, and to flourish. So this is how I try to contextualize my work. And I wanted to start the presentation with this important thought, because the way we've historically thought about what does it look like to understand Black men has really been almost like a monocular kind of perspective, right? If we focus on the problems, if we focus on the disease, then we can solve the problems and cure the disease. But I really like this idea of a strengths-based perspective, because it takes that sort of monolithic look and really, you know, instead of looking at it from a monocular point of view, you actually have binoculars, right? So you have an additional layer of understanding that in my mind really strikes me as more of a strengths-based perspective. So not focusing on the problems, focusing on the solutions and what kinds of things can we do to support Black men in their lives. Now, I wanted to start there because that's really how I see my work. And this is how I've been trying to contextualize my work over the years. I try to focus on the strengths or the positive aspects about what it means to be a Black man in our society. And I've studied things like depression and anxiety, masculinity or manhood, and also social support. And my work is sort of contextualized in that scope. And I present this only to just guide our thinking around, you know, these sort of different life course milestones that Black men in particular hit. And this is, of course, focusing on the adult life course for Black men. Because I really do a deep dive into what we call the social determinants of mental health and health for Black men. And so we think about young, middle, and older Black men. And by young, I'm talking about that 18 to 30-year-old Black man. And what does it look like for them to experience these 6 social determinants at the bottom of this triangle here in the context of just becoming who they are? and acknowledging differences and understanding that how they see themselves in the context of their family and friends may be different from how they want to see themselves as they get older. And then of course that middle adulthood group is really looking at Black men ages 31 to 54 and what they experience during that stage of life that may differ from the younger stages of their life. During that stage, they're probably getting more involved in work and experiencing maybe some stress and some discrimination from their workplace, maybe understanding what does it look like to partner with someone, maybe even have kids, buy a home, things like that in that middle adult life stage. And then of course, older men are grappling with different challenges, things around maybe retirement or a fixed income. And some of the older Black men I've talked to over the years have even talked about, you know, coming to grips with their own mortality. What does it look like, you know, to witness friends and family members who are dying? But in the context of today's presentation, I'm focusing really on this young adult life stage, that 18 to 30-year-old life stage for Black men. And for the past few years, I've been really narrowly focused on this life stage, primarily because there's so much around development and so much around learning and growth that happens for young adult Black men during that stage. And then of course, in the world that we live in today, which is very focused on technology, I would be remiss to not do some deep diving into what does technology look like for Black men and how can we leverage our resources. So here are just some publications from some colleagues of mine. Some are on the line today, so big shout out to them, where we've partnered to really understand and try to understand what does internet use look like for Black men and how can we maybe create interventions to help improve some of their health outcomes. But in particular, as I think about that 18 to 30-year-old age group, it's hard to not think about social media. Right? I mean, this is something that's impacting our lives daily, whether we want it to or not, whatever your social media platform of choice is, we're seeing lots of information being conveyed through social media. And so when I begin to partner this understanding of the importance and the value of internet and social media in the lives of Black men, in my deep dive into understanding their experiences as Black men, I came up with a question. And that question was, what would happen if we used social media as a tool to improve mental health, to promote positive or more progressive definitions of manhood, and increase social support specifically for Black men? And so that led me to develop the Young Black Men, Masculinities, and Mental Health Project. And so in the next few slides, I'm going to talk about the project. This project was conceptualized in 2008. We did our first iteration in 2014, right here in the state of Michigan. But the data that I'm going to present today is really from our last iteration of the project that we did with Black college men at 2 large universities right here in the Midwest. And so I'll get into those data in just a second. But before I do, let me give you a sense for the kind of Black men we typically enroll in the YBMen project. So we typically look for Black men, young Black men, who may be less likely to discuss sensitive topics face-to-face, so they have a sense of privacy, or maybe they even sense the stigma that's attached to mental health in their lives. We also recruit Black men whose distress has not yet reached clinical severity. So by that I mean, we do not include Black men who have been diagnosed by a clinician with any kind of mood or anxiety disorder. I mean, we certainly understand that what we are doing is not e-therapy. We don't treat Black men in our intervention. This is more of an educational intervention. And so we do have Black male clinicians on staff who, should someone be flagged, we can refer them to our clinicians on the team. And then finally, which is really important, we bring Black men into this intervention who want to have conversations about mental health, manhood, and social support in a social media-based setting that is private and secure. So let me give you a sense for the flow of YBMen and how it has worked over time. So if you look on the left side of your screen, that's sort of just a little path to give you a sense of how we collect our data, how we do the intervention, and how we engage with our participants. So we always start out with a baseline interview. We have participants do this online interview. Actually it is online. We have participants do an interview typically through Skype or something like that, Zoom, Blue Jeans. We've used a little bit of everything in the past. We also have participants complete a baseline survey. and then they get an incentive for completing the survey and the interview. But from that survey, we actually provide a question where participants can opt in to the YBMen program. So they can say, yes, I'd like to be a part of the program, or no, I don't want to be a part of the program. After we get that group of men identified, we actually do the program. So this is number 4 on this path here. Then at the conclusion of the program, we have the participants who did the YBMen program complete a second round of interviews and surveys. And then of course we provide an incentive for their completion of the 2. So in the next few slides, like I mentioned, I just wanna clue you into what I would consider more like hot off the presses kind of data, because we just finished the analysis for our 2017 to 2018 iteration of the project. And we have a publication that's forthcoming this year with these data that I'm about to present. So for this more recent iteration, we did that first round of surveys, and we had 350 Black college men from 2 large universities here in the Midwest complete the survey. We had about 50 guys who actually opted into the YBMen program, but about 40 of them saw things through to the end. And what we did was we actually had 40 guys at the end who self-selected into the YBMen program. So this is just a mock-up of what a curriculum could look like for the YBMen program. Just so you know, whenever we have an iteration of the program that we plan to implement, our team gets together, we have multiple brainstorming meetings, we talk about what we want to include in the program, what kinds of topics we want to include. So this is definitely not one of the programs that looks the same every year. I think what we really are trying to capture with that process is we're really trying to convey this idea that all Black men are not monolithic, right? There are different types of ways that Black men conduct themselves and navigate the world. And so we want to be mindful that they're not all the same, and we want to make sure that we account for that. And so you'll see here on this mock-up that we have different weeks, and certainly in the past, for the past few years, YBMen has been as short as 2 weeks long. It's been as long as maybe 5 or 6 weeks. And my team right now is working on a 12-week long program that is going to incorporate many of the aspects that we're seeing right now in the current world with regard to COVID and other racial profiling of Black men. But for those of you who are looking at the screen right now, you probably see some people that you recognize. And so I should mention now that one of the cornerstones of the YBMen project is that we use lots of social media and pop culture prompts. So this is the way that we engage our young Black men in the intervention. Certainly we provide educational materials, we pose questions, but we also show them characters, music artists, actors, activists, even people who have come up in the news. And we engage them around conversations, if you will, with and about these particular figures. So I just wanted to give you a sense for like what is happening behind the scenes with regard to YBMen. And certainly each of our weeks are broken out into different topics, and the topics typically vary based on the partners that we have. So whenever we do any iteration, we have different campuses and community groups that we partner with. We have our 3 major core outcomes, which is mental health, masculinity, and social support, but certainly people have asked us to build different topics into the curriculum over the past few years. Okay, so this is just a sample mock-up of what that could look like. So what do YBMen participants actually experience? What do they see? So I decided to show what some of that live interaction can look like in Facebook. And so in this last iteration, we did use Facebook as our social media platform as our way to interact with the guys. So you see back then when we did the iteration, we were talking about Colin Kaepernick taking a knee, and you'll see participants whose names I've blinded here are really engaging in this sort of online discussion about what does that mean? You know, taking a knee, how is that a symbol for Black men and solidarity? And so I just wanted to give you just a sense for the kinds of things that we talk about here. So we talk about what's happening in real time. So you have to imagine this is 2017, 2018. So this was really a hot topic back then as it is right now. You know, we also use a lot of YouTube videos, song lyrics. We post things that the guys are listening to themselves, the things that they may actually have questions about. And so we have to sort of stay up to date with what's happening in pop culture in order to be able to engage men in this way. And so one of the things that you'll notice about each of these screens that I'm clicking through is that you'll see paragraphs, you know, of ways that Black men are engaging with one another around topics. And so it's really funny, whenever I present this work in conferences, I often hear people say, well, how are you getting, you know, young Black men to talk? Because whenever I'm doing work with them, they never seem to want to communicate, they never want to engage. And I'm here to tell you as a witness, these guys talk. They need no real prompts from us. I mean, certainly we're there, but they have something to say. And so I just want to acknowledge this idea of, you know, a lot of these guys tell us that no one has ever asked them before how they feel about certain things or what they think about what's happening in the world. And so what we've learned is that if you ask, we get a ton of responses back. So I just wanted to share some of the prompts here. One of the topics that came up during this last iteration, as you can see on this screen, was this idea about what it means to be a Black college man and to have that college identity attached to them, many of them as first-generation college students, and what that meant for the people back home. And so we had some really deep discussions in the Facebook group, the private Facebook group, about what are the implications for that and how that can likely be frustrating for them as they're trying to navigate the spaces. So now I want to transition into just some results. I'm going to start with just some results from our surveys, pre and post the intervention, then also I'm going to provide a few quotes at the end. So if you take a look at this slide, what we're looking for is we're hoping to see a decrease in depressive symptoms over the course of the intervention. And so if you can imagine before and after the intervention happening, and the YBMen logo in the middle is just to indicate that's when the intervention happened. For YBMen, we use two measures of depressive symptoms. We use something that many academics will know, the PHQ-9, which is a very clinical measure of depressive symptoms. But we use another measure that maybe people don't know about. It's the Gotland Male Depression Scale. Now, the PHQ-9 tends to ask items about feeling sad, worthless, hopeless, whereas the Gotland Male Depression Scale, or the GMDS, has more items that are geared maybe towards like a more masculine kind of language or tone. They ask about irritability and anger and frustration. And so some will say that because that scale tends to not lean on language that tends to be sort of more feminine, like sadness and hopeless and worthlessness, that may be a more accurate measure for capturing depression in men. So you'll see here on this this table here that this figure that the blue is how men in our intervention, our 40 men, scored before YBMen and after YBMen, and how they scored on the, how they scored on the PHQ-9 is the blue, and how they scored on the Gotland Male Depression Scale is the orange. And so we want these scores to decrease, and that's exactly what they did for us. We also saw that this change was statistically significant. And I also want to just show you some of the items with regard to masculine norms. So we tend to use the Conformity to Masculine Norms Inventory, CMNI, as our measure for traditional masculine norms. It has different subscales. Some of them are here. Things like this idea about winning, having emotional control, relying on oneself. This idea of being a playboy is also a subscale that's included in the CMNI, as well as the primacy of work and heterosexual self-presentation. The idea is we want these scores to decrease over time. And so you'll see if the blue is before and the orange is after the YBMen intervention, some of them decreased, others of them increased. This typically varies based on not only the content that we put in the intervention every year, but also what's happening in the world. And the only change here that was statistically significant was this idea of being a playboy. We can talk about that during the Q&A session. And then finally, our last core measure that we included in this iteration was this idea of social support. And we want this to increase over time. We want guys, as a result of YBMen, to feel like they have more support. And so to the far left of the screen here is the overall total score. We did see social support increase. And then there are 3 subscales in our social support measure that also showed some increases over time, though none of the changes were statistically significant. A lot of things could certainly influence that. Ideally, the low end, or the fact that we had 40 guys in this iteration and not 100 or 200 guys, could certainly influence that. Okay, so those are some of the quantitative or the statistics data that I wanted to present. I also could not end this presentation without talking about their words, right? Really highlighting the things they told us with regard to what YBMen was like for them and how they interpreted some of the things that we talked about in the intervention. For example, when it came to this idea of what mental health and depression means to them, one of the guys said, when I think of depression, I think of it across a spectrum. I think a lot of times when people talk about depression, we only talk about it in the most severe stage of it. We don't talk about the early phases of it and other forms of mental health challenges that can lead to depression. So I think there are two very complex issues and words, and I honestly don't know if there's one real definition to define them. Wow, right? So even this idea of depression and mental health not being synonymous, which is something that I found early in my research, that now this generation of Black men may be able to sort of parse these two things out a little bit better and understand that it's not as clear cut as maybe they were once taught or maybe they believed some years ago. Some of our intervention results around masculinities showed us that they see masculinities being very different. So one guy said, from my personal experience, I think Black men's experience with masculinity is more severe than some other cultures. I feel like other cultures, especially white cultures, are more likely to talk about counseling and getting professional help or talking to a therapist with their children growing up versus in a Black community. It's like, no, you deal with it. You go deal with it on your own. You don't let things that happen in your family get outside that family. So just talking about what Black culture is like and how Black culture and sort of traditional ways that Black communities have dealt with things, how that can translate into maybe not seeking help if it's needed. Another quote that came out of this was around stress and how it can be different for Black men. One guy said, they call stress the silent killer that will build up and that eats away at you over time. Also, in a land where you're supposed to be able to do things such as protest freely in a peaceful manner, you have people saying you can't do this. Many see other people getting away with other types of activities and just not being condoned for it. And then the last quote or set of quotes that I want to show is really, how did the guys feel about the YBMen project? Because with every iteration, we want to make sure that the guys are receiving the information positively, that they feel like it's helping them. And here are just two quotes that we pulled from the guys after the intervention was complete. One guy said, what you guys are doing, the actual program and trying to spread awareness about mental health to Black men, I think it's really good. Another guy said, the YBMen group was definitely a safe space where you can talk about your ideas as Black men and talk about your opinions on things without judgment, without backlash. Because this was a private group, only we could see what we were saying. It just felt good. And it showed me what having a social support group would be like. Okay, so I just wanted to share some of these powerful words, but then also give you a sense for just numerically how some of our outcome data looked. So as I begin to wrap up, because I'm really looking forward to the question and answer period, I just want to give you a sense of our current reach. So far, we have been able to do YBMen in about 5 or 6 college campuses here in the state of Michigan and 1 in Ohio. And for those of you who are in different parts of the country, this is a little picture of the state of Michigan, the mitten. And so we've done that work so far with Black college men mostly. We've also done some pilot work with translating the YBMen project to maybe even a middle school audience. So we do have some preliminary data exploring this idea of what would it look like to have these conversations with Black men when they're Black male adolescents. And so we're finding some really interesting outcomes with regard to how Black adolescents, male adolescents, are talking about things like mental health, how they define themselves as men, and also social support. And we're in the current process right now of delivering a program, or actually doing the preliminary work to figure out if we wanted to tailor the YBMen project for high school students. So for Black male high school students, what would that look like? So far, this is our reach. But certainly we are striving for, world domination, right? We're looking to see how can we expand this work across the United States and also to some of our colleagues in Toronto. So we're really looking forward to see what does this look like in the coming months and coming years. And certainly the fact that YBMen is a 100% online intervention or online program, I think there's a lot of promise for being able to reach more Black males across various ages with regard to, what they're dealing with given what's happening in the world right now. And so I just want to end with a couple of notes, and then again, I look forward to the Q&A part. So I want to end on a positive note, actually. I want to remind folks that even though different things are popping up in your social media feeds, Black men are resourceful. I think we have to do a better job of focusing on the promise of Black men and not the problems. I think if we focus more on the competencies and responses to adverse circumstances, we'll get a deeper understanding about what they're experiencing. So I really see what Black men are going through right now is their ability is really focused on how they adapt to adversity, right? So think about it as adaptation. And sometimes as they adapt to adversity, sometimes those adaptations are problematic, other times they're not. But unfortunately, I find that when it comes to media and it comes to the narrative that's put out there about Black men, oftentimes the problematic adaptation is what gets most of the attention. And then I also want to remind you that Black men are resilient. They have been here, they are here, and they will be here. And so I would love to see us as a community do a much better job of being allies to Black men and also doing whatever is in our power to support them in their different stages of life and also in their different spaces in which we engage with them. So yeah, I would just end with, what would happen if we saw Black men through their eyes rather than through our own eyes. And with that, I'll just point you to a few publications that have come out so far about the YBMen project. All of the data that I presented in today's presentation is actually in this very last publication that is forthcoming in the American Journal of Men's Health. So if there are any gaps in any of the things I said today, certainly check out that publication that will likely be out in a few months. And with that, I'll go ahead and wrap up and say thank you to all of the folks that have supported us financially over the years. Also, big shout out to the YBMen project team, many of them who are on the line, our new associate directors, and folks who collect the data and help us analyze the data and put this work out. Really look forward to Q&A, and certainly my contact information is here if anyone wants to reach out to me. Thank you.
Dr. Watkins, thank you so much. Everyone give a virtual hand,
Oh.
your snap, whatever you do to acknowledge this great work. Thank you for sharing with us. The first question that we want to highlight and send your way comes from Dr. Linda Lean, former superintendent of Pittsburgh Public Schools, who's joining us today. And she wants to know, since in the initial part of the study you discussed the subjects were college young men, mm-hmm. How do these findings relate to the population of young Black men as a whole? When you started to talk about that a little bit, I think our audience would be interested in how schools might think about this kind of work.
Yeah, certainly. So it's really funny you ask that question because so I'll take 15 seconds to vent and then I'll answer the question directly. What's interesting is that the majority of the grants that I've applied for over the past few years has not just focused on Black college men. I've actually wanted to do more work with Black men in the community. Those grants don't get funded. So I've heard from reviewers who worry that there is a risk in doing this kind of work with community-based Black men as opposed to college-based Black men. So we can have a separate conversation about what that risk could look like because a lot of funders feel like it's better to support Black men who are sort of already on the quote unquote right path in college. So unfortunately, we haven't had a chance to do a lot of this work with community settings. But now I'll answer your question directly. What we're finding is that a lot of the guys who participated in our intervention to date tend to be college freshmen. And so they're coming in eyes wide open. I would even go as far as to say deer caught in the headlights, if you will. And so a lot of their experiences that they've had to date haven't been in college because they just got to college. So they're talking more, especially in those baseline interviews, about what it was like to be in high school and what it was like to not be in college. And so I would argue that certainly there is some room in this kind of work to just do the complete intervention in a community-based setting, but I don't take lightly the experiences of many of our participants who are just coming out of high school and coming to college and really still having that kind of mentality and talking about things that are really germane to them back home, not necessarily in the college setting yet. But I absolutely think this is the kind of work that will translate very well into communities. So we just definitely have to look forward to getting more support that will allow us to do that. Right. That's a great question. Yeah.
So Daphne, you have a question from Stephen Thomas, I believe is Dr. Stephen Thomas. The question is about the message and the messenger matter. And so given your team and yourself as African-American, could this work be done by academics of other races and potentially genders? What's your thoughts about that?
Interesting. Huh. It's also a good question. So what initially popped in my mind was this idea that, you know, I'm trying to think of the exact quote. It's essentially, if you're going to do work with us, ask us, no, I think it's nothing for us without us. I think that's the quote. And so I was thinking that over the years, I've had quite a few team members who were not African-American or Black. And so I certainly value their contributions to our team. But I guess if the question is, can the work with Black men be done without Black men or without Black people, I would be cautious about that. I would feel like there should be people on the team who could speak a little bit more intelligently and more accurately about the experiences of Black people. In today's society, there's so many things happening around us right now that I would worry if we didn't include more Black people in this kind of work. Now, it doesn't mean that people who are not allies and who don't feel passionate or don't even identify with the experiences of Black men couldn't be a part of it, but I would be concerned if we excluded Black people in this kind of work. Now, the last thing I'll say to that question is I have received inquiries over the years about doing like a Latinx version of this project or doing an Asian American or Native American or American Indian version of the project. And I definitely think that is possible. And we've explored some of those options. But as a Black woman, I wouldn't feel comfortable pursuing that work without including colleagues and community members and men themselves who identified with those racial and ethnic groups.
Yeah, and I am willing to jump in as your agent. It appears that there's a lot of demand here and people are asking, so you might need some help with that. So I got you covered. I'm more than willing.
Thank you. I appreciate that. I appreciate that.
Our next question comes from Dr. Jeanette Southpaw, and she wants to know if you found any differences in this work in terms of outcomes and experiences by Black ethnicity. So different parts of the diaspora.
Oh, I love that question. Yes. Oh gosh, that's Dr. Jeanette. Our qualitative data is so rich. And I'm not just saying that because I'm a mixed methods researcher. I really do think that there are things that we're learning on the qualitative side that we would never be able to capture on the quant side. And mainly one of those things is differences in ethnicity. So some of the guys talk about growing up in Jamaican families or traditionally African families, and what does that look like with regard to mental health, manhood, and social support. And as you can imagine, it can look very different compared to Black men who are growing up right here in the United States. And so yes, we're seeing that, and we're able to unpack that more so on the qualitative side with our interview data than we can on the quant side with the survey data.
Actually, it's an interesting methodological question from Tiffany Washington. And the question is, were there any special IRB considerations related to privacy with the use of Facebook?
No, we didn't. I think we anticipated some, and we did have to really think deeply about what does the private Facebook group look like, and do we want to be able to access our participants' friend list, which we chose not to do because that would add another layer of security that we needed to pass through. But if they wanted to share something, I think we wanted to allow them to do that. Like, let's say, for example, we posted a really provocative image or a really interesting meme in our group. Participants could have absolutely shared that with their friend circle in Facebook, but we would not be able to access that. The IRB really didn't give us too difficult of a time with regard to that, surprisingly. And yeah, I just think they now, given the use of social media and so much research right now, I think they already had certain standards and protocols in place and just applied those to our work.
Did folks invite their friends to
the group? No.
Okay.
No.
Thank you.
We have a question from Jackie Strong, and Jackie wants to know how you teach about internalized racism as related to mental health in this work.
Yeah, so we have to address it. I mean, I think it's the elephant in the room. It's one of multiple elephants in the room right now, especially as we talk about Black men who may be at predominantly white institutions. And so while the intervention does not address it directly, I would be lying to you if I told you some of these conversations did not come up in some of these Facebook groups. And so I wouldn't say I necessarily teach about it, but I definitely allow the men space and time and privacy to engage around these conversations. And should they pose questions directly, we definitely address them with this intervention. So, but that's not the overall goal of the program itself.
As a follow-up, because I know we do a lot of work with racial socialization here at Pitt, and you've got some of the leaders in the field there at Michigan. Mm-hmm. The participants talk about how their parents have told them about race and thinking about that, and is that a source of resilience?
Yeah, there are some great folks doing some work in racial socialization here at Michigan and also at UPenn. Yeah.
So Jalen Evans-Williams has two related questions. One is, what are the implications of your work for practitioners who work with African-American men? Mm-hmm. And then related to that is, and then what resources are available to seek out once you become aware of if they're depressed or having a situation where they need some additional follow-on help. So. Mm-hmm.
Yeah, so I think the work that we do has a lot of implications for clinical practice with Black men. What we're realizing is that the work that we're doing in particular, so there are a lot of implications, but I'll highlight one in particular, and certainly we can have a sidebar conversation for if you want to learn about some others. But one of the things that we realized about our intervention is that it's really building mental health literacy for Black men. Some of my earlier work with Black college men, I mean, even as early as maybe 2005, 2006, was really about unpacking definitions and what do these terms mean to Black men. And as I mentioned earlier in my talk, a lot of the guys I talked to saw very different terms synonymously. And so what we've been able to do with the YBMen intervention is kind of parse these things out and help guys further define what these terms mean on the clinical side, but also what they mean for them. And so I think that is a huge implication for clinical practice, because these guys may be able to go to a clinician, a social worker, a mental health practitioner, and have a way that they can explain what they're experiencing as a result of the intervention. They've been able to engage with participants, with other Black men for, maybe 2 to 8 to 12 weeks. And now they almost have like a toolbox, like a box of ways that they can now better articulate to their clinicians what they're experiencing. So that's one implication that comes to mind when I think about how it could relate to clinical practice. And then the second question, John, I may have forgotten. I might have.
Yeah. Just the resources that you make available. So if a young person is, depressed or experiencing mental health challenges, what resources do you make available to them?
Yeah. So, for our program participants, is that what?
Yes.
Yeah. So we have 2 Black male clinicians right now on our YBMen team who this is what they do. Right. And so they have private practices here in the area. And if we see a red flag, we call our clinicians, we ask them to do a follow-up with the participant. We've had cases where at least one of our clinicians I'm thinking of right now actually ended up taking one of our potential participants on as a client. And so they've had a chance to do some clinical work over the years, and that's been pretty successful. So we have people on our team that can do this, but as a YBMen team, we take full responsibility for also producing health education materials. And a lot of it is based on our work. A lot of it is based on other great colleagues who are doing work in this area to make sure that there are resources out there that are specifically tailored to Black men. So culturally appropriate, age specific, and gender specific. So that's really our goal, is to not say, oh, here is a flyer about men. No, here is a one-page handout or a booklet about Black men specifically in your age group and what they may be dealing with. So we find that that has been really useful for the work that comes out of the stuff that we do, that the products that we have for YBMen. And I think some of the clinicians would really appreciate that as well.
Thank you.
We have a question that's come up since George Floyd and everything that's happened this summer. And one of our audience members says, as a white man, how can I help my African-American friends and other men I might interact with? And this doesn't sound like it's in a clinical setting, but this is just in life. What can people do to be supportive?
So I'm gonna cheat a little bit and I'm going to answer, but I'd actually be curious, Jay and John, how you would answer this question too, because I've heard different things, I've seen different things. I think that the predominant narrative that I've seen is not expecting Black people, especially, in this case, what we're talking about today, Black men, to educate you about certain aspects of racism and white supremacy and what that means. There will be awkward conversations. I think you cannot be afraid to say the words that we've not said for so many years, like racism and murder and white supremacy, and a lot of the terms that people are afraid to say. We have to find some comfort in talking about these things. Difficult conversations are expected, and my advice is, none of us are doing this perfectly. We are all making mistakes, but you can't use your fear of making mistakes as an excuse for why you don't engage in the difficult conversations. I always see Black men, and anybody for that matter, as being an expert on their own life. And so I try to remove all sense of stereotypes, bias, even the ones that I have in my own life around engaging with different people, and just assume and trust that they are the expert in their own life. So I don't have the best advice maybe, but I wipe the slate clean with every person, regardless of what I see on TV, regardless of my previous, interactions with family members or people in the community, or even YBMen participants. So that's my 2 cents. I'd be curious to hear what Jay and John have about that, because that's a big question. That's a really big question and very relevant right now.
Yeah, I would say it depends on the relationship prior to whatever the particular event is. So if you have a relationship with someone and you're able to just listen and you have a legitimate friendship, then I think there's much more willingness to talk. And often listening is the most powerful thing, at least in my experience, that people can do, and to not try to make excuses. So if I'm talking about Black Lives Matter, I really don't want to hear about all lives mattering at the moment, right? And so it really is being willing to hear and to listen, and sometimes just be quiet and just be present. And so that's most helpful. But again, I think the key is the nature of the pre-existing relationship. That really helps determine. And if people genuinely feel like that you are trying to learn, and that there is an existing relationship that both of us are invested in, for me, then I've been willing to have some pretty difficult conversations with folk that otherwise probably would not have had.
Yeah, I think for me, one thing I think anybody can do and white men can do, and is really just make sure you're learning about these issues and the history of these issues. I'm always, kind of stunned the degree to which my students, sometimes colleagues, just don't know the racial history of the country. Like these things pop out in a vacuum to many people. Well, if you know about redlining and you know about economic policies that were deliberately against Blacks in the 20th century, you know about white American terrorism, then you kind of understand where these things have generated from. And I think we just have responsibility as citizens and as people in this society to take that up. And then I think the other thing is, you know, showing strong support of Black voices. So if I'm in faculty meeting and I'm saying, I think this is an important agenda item for advancing racial justice in our school, in our university, I mean, are you supporting the Black voices that you're hearing when they're talking about their experiences? And you know, one of my other questions was going to sort of be about the fact that if you're a Black man, Black people, right now you kind of have a layer burden of dealing with society as it is, but then trying to also dust yourself off to respond to the things that are happening. And you might be getting more calls than usual to respond. And so having strong allies willing to participate in that is really important.
Yeah, I agree. All right, and I'm just gonna stop sharing my screen. So during this last part of the Q&A, hopefully that's okay. Maybe our videos will be a little bigger.
That's fine.
Okay.
Yeah, we're about out of time, so I'm kind of looking to see who are the lucky last questions or question person. Who's that going to be? So.
Well, while Jay's checking, I want to jump in.
Go ahead.
First of all, how do we stay current, right? So it appears that much of your work really is about keeping these issues that are on the front of the young men's minds priority. So at this moment, for example, and I don't know if you're actively in the field, but how do we stay current and how do we actually find out where they are in this moment? I know for me I guess I'm OBE, use 54 as your cutoff. I'm a little hurt about that. But as a old Black guy, the current moment is tough, right? And so how do you kind of stay current and pay attention to the things that are going on in the culture in ways that are meaningful, but also provide space for these young men to talk? Because as you note, there are these guys who people kind of don't think are very talkative. You just have found the venue and a median, but how do you kind of keep current and keep up with them?
You know, I'm definitely leaning into some of the older, at least middle and older ages too. And my secret is I keep the actual Black men that we work with in terms of our research participants, I make sure that we model that on our team as well. You know, I mean, there's no way that I by myself can keep up with every, matter that's happening in the world right now with regard to pop culture or even newsworthy kinds of events. So I make sure our team is chock full of people who keeps up with those things. And so I'm definitely not as cool as I used to be. I used to be able to keep up with that. I just can't anymore. But how powerful is it if we engage the people that we're trying to help in the creation of these tools, right? So we have people sitting at the table who look like the people we want to help with the intervention. And that is really the secret.
Thank you. That's good.
Yeah.
You're muted, Jay.
I think we can let that be the last question. And so I'd like everyone to, once again, thank our presenter, Dr. Watkins. And I just want to highlight, you can follow her on social media at Dr. Daphne Watkins and follow her center at center_Curtis. As always, follow us as well. And we thank you for joining us today. Please stay on the lookout for more events from the Center on Race and Social Problems, and check us out on social media to stay up with us. So thank you, everyone. We'll see you soon.
Thanks, Daphne.
Thank you. Have a great day, guys.
Bye-bye.